Hi viewers, welcome back. In today's video, we are going to discuss about menstrual cycle. Actually, this is a very simple topic, but most of the time we don't understand the subject. Okay, so let us study this topic in a simple and easy way. Okay, so what is menstrual cycle? Menstrual cycle is like you have 4 phases in the menstrual cycle where you start with bleeding and you end up with the next cycle. Usually a regular menstrual cycle is around 28 days cycle. Okay, so for some people it is 25 days, 26 days, sometimes it is 32 days. So it may vary, but for a particular person it stays constant. Okay, so now we will discuss the menstrual phases. So we have 4 phases. The first phase is the menstrual phase, that is going to last from 1 to 5 days. So which is going to be the bleeding phase. So in this 5 days the woman is going to bleed. Okay, that is your menstrual phase. Here the endometrium is shed in this first 5 days where the estrogen level is suppressed or the estrogen level is very low. So the cervical mucus is scanty, viscous and opaque. So this is the normal cervical mucus when there is a menstrual phase. Then we have the next phase of the proliferative phase, which is going to last for 6 to 14 days. Okay, so during this proliferative phase, what is going to happen? So in the menstrual phase we saw the estrogen level is coming down, but here in the proliferative phase the estrogen level is going to increase. So when the estrogen level increase, the endometrial thickness is also going to increase. So what is this endometrium? This is the thickness of the inner layer of the uterus. So this is going to form like a bed. So usually we call it as an endometrial bed, which is going to lay down the foundation for the like zygote to get implanted. So this endometrial area has to be thick, which is going to happen in the proliferative phase when the estrogen level is going to be high. So you understood, in menstrual phase the estrogen level is low, in proliferative phase the estrogen level is high. Because of that the endometrium is becoming thick. So all the factors are favoring the sperm. So what is happening? The cervical mucus is going to become very thin. So usually in these days what happens? You will get a mucus secretion which is going to be watery or thin in layer, and it is going to be alkaline in nature. So usually the elasticity, so that is like when you touch and see the cervical mucus, the elasticity or the thickness is going to be very less. It is going to be very thin, which is going to help the sperm in movement inside the uterus. So what happens? So you have a sign called as Ferning pattern. So that is your spin barket sign, which is helping the sperm to move further into the uterus. So that is with your menstrual phase and with your proliferative phase. So proliferative phase is from day 6 to 14 days. Okay, so until now the endometrium is getting ready for the sperm to come in contact. Then comes the secretory phase. So secretory phase, what happens? The estrogen level drops, progesterone level increases. So we all know progesterone is a very important factor for the growth of the fetus. So what happens? Now the estrogen level has to come down and the progesterone has to increase. So for the first 3 months of pregnancy, your progesterone is going to take up the role in growing up the fetus. So your progesterone level has to increase and increase, double and triple day by day. So what happens to the endometrium? The endometrium becomes very thick. So it becomes dilated and it becomes very much more like perfused with blood flow. So it is preparing for the fertilized ovum to get implanted. So in this phase the sperm comes and meets the egg and the formation of zygote taking place, where it goes and gets implanted in the endometrial bed. Then comes the ischemic phase. As the term says, ischemia is decreased blood flow, or there is no blood flow at all. So now what is happening in this area? The estrogen level is also coming down, the progesterone level is also coming down. So there is no hormones to the uterine supply. So for the endometrial bed, there is no hormones, there is no blood flow. So what happens? So it has been waiting till the secretory phase for a sperm to come and meet the egg. So nothing has taken place. So what happens? So this bed thinks, okay, this month my egg is going to be wasted. So what happens? It gets shedding out the endometrium. So the endometrium was big, no? So now it has to thin out. So what happens? So vasoconstriction, that is decreased blood flow to the uterus, takes place, and because of that the blood from the endometrium starts pooling and it gets escaped from the endometrial surfaces, which you term it as menstrual flow. Okay, so this is with your menstrual phase, proliferative phase, secretory phase, and your ischemic phase. So I will just tell you a story. So menstrual phase, increased estrogen, so the cervical mucus is thick, so you have bleeding for 1 to 5 days. Then the proliferative phase, where the estrogen level is high, endometrial thickness is high, it is favoring the sperm to come in contact with the ovum. Then the exact phase of the secretory phase, where the estrogen level drops, progesterone level increases. The endometrial bed is getting ready for the zygote to get implanted. So once the sperm meets the egg, the implantation takes place in the secretory phase. And finally, if nothing happens in the secretory phase, the ischemic phase takes place, where both the hormones come down, there is no blood flow to the uterus. So whatever the endometrial bed was there, everything is going to get shed down, which we term it as menstruation. So that is your menstrual cycle, as a simple story I have said you, which is very easy for you to understand. So we can also term this menstrual phase into the ovarian cycle. So ovarian cycle, here we are going to tell these 28 days into two phases, that is your follicular phase and the luteal phase. So follicular phase is 1 to 14 days, that is the apt period for the sperm, for the egg to go and meet, and for the zygote formation. Then comes the luteal phase. In case your follicle stimulating hormone is going to increase, and the growth is also going to increase with your follicular phase. But in your luteal phase, the luteal hormone is going to increase, and after the rupture of the follicle takes place, so what happens? The follicles get out and you have the corpus luteum formed. So that is with your follicular phase and the luteal phase. So this is a simple picture which is telling you the cycles. So this is your menstrual cycle, where the endometrial, this is your endometrial thickness, you just remember, okay. Endometrium is going to be mild in this 1 to 5 days with decreased estrogen level. So here from 6 to 14 days your proliferative phase, where it is going to increase with your increased estrogen level, and then the secretory phase taking place, where the estrogen level drops and the progesterone level increases. So the endometrium increases to the core, so it increases to the high level, and when there is no meeting of the sperm and ovum taking place, so what happens? It comes down so to the ischemic phase of 27 to 28 days. Then the next menstrual period starts. Okay, so this gives you a clear idea about your menstrual cycle. So in the next class I will tell you what are the abnormal menstrual disorders or the abnormal menstruations which is present in female. Hope this you understood the class. In case of any doubts, kindly comment in the comment box. Take care. Bye.